The reliability of medical diagnoses hinges on the accuracy of laboratory test results. These results, in turn, depend heavily on the quality of the samples being analyzed. From the moment a sample is collected to the moment it is analyzed, a chain of custody must be maintained to guarantee its integrity. This is where ISO 20658 comes in. ISO 20658 is an international standard that outlines best practices for handling samples in medical laboratories. It provides a comprehensive framework to ensure that samples are collected, transported, received, and handled in a way that minimizes errors and maintains their integrity. This standard is essential for any laboratory involved in the analysis of human samples. By adhering to ISO 20658, medical laboratories demonstrate their commitment to quality. This commitment translates into more accurate diagnoses, more effective treatments, and ultimately better patient care. The standard also helps laboratories meet regulatory requirements and enhance their overall efficiency. In the following sections, we will delve into the specific clauses of ISO 20658, exploring their implications and importance in detail. The scope of ISO 20658 is clearly defined, ensuring its relevance and applicability across a wide range of laboratory settings. This standard applies to all processes that directly impact the integrity of samples intended for medical laboratory testing. This includes, but is not limited to, blood, urine, tissue, and other bodily fluids. The standard is applicable to laboratories of all sizes and specialties, including those in hospitals, clinics, and research facilities. Furthermore, ISO 20658 considers all personnel involved in the sample journey, emphasizing the importance of a unified approach to quality. This encompasses individuals responsible for sample collection, transportation, reception, processing, and analysis. By addressing the roles and responsibilities of all stakeholders, the standard fosters a culture of accountability throughout the entire process. ISO 20658 does not stand alone. It builds upon a foundation of other established standards and guidelines. This section highlights the importance of these normative references in ensuring a comprehensive approach to sample management. These references may include standards related to quality management systems, laboratory accreditation, and specific analytical methods. By incorporating these existing standards, ISO 20658 avoids redundancy and promotes harmonization within the broader framework of laboratory quality assurance. For example, the standard might reference ISO 15189, which focuses specifically on the quality and competence of medical laboratories. This interconnectedness ensures that laboratories implementing ISO 20658 are aligned with internationally recognized best practices. It also facilitates a more holistic approach to quality management within the laboratory setting. Section 4, Clause 3, Terms and Definitions. Speaking the same language. Clear and unambiguous communication is paramount in the context of laboratory medicine. To avoid misinterpretations and ensure everyone is on the same page, ISO 20658 provides a comprehensive glossary of terms and definitions. This section is crucial for establishing a common understanding of key concepts related to sample management. For instance, the standard defines terms like pre-analytical phase, sample integrity, and chain of custody with precision. Having a standardized vocabulary ensures that all stakeholders, from clinicians to laboratory technicians, interpret the requirements of the standard consistently. This clarity minimizes the risk of errors and promotes effective communication throughout the sample handling process. Accurate and consistent terminology is the bedrock of a robust quality management system. Section 5, Clause 4, Sample Collection, the first link in the chain of custody. The journey of a medical laboratory sample begins with its collection, marking the first and crucial step in the chain of custody. This initial step is critical, as any errors or deviations during collection can have a ripple effect, impacting the accuracy and reliability of the entire testing process, potentially leading to misdiagnosis or incorrect treatment. ISO 20658 outlines specific procedures to ensure proper sample collection. Patient identification is paramount, serving as the foundation for accurate testing. The standard mandates a two-identifier system to prevent mismatches and ensure the correct sample is collected from the intended patient, thereby minimizing the risk of errors. The standard also addresses sample collection methods, providing detailed guidelines for various types of samples. Different sample types require specific collection techniques tailored to the nature of the sample and the tests to be performed. For example, blood collection might involve venipuncture or capillary puncture, each with its own set of protocols to ensure sample integrity, while urine collection might require a clean catch midstream method to avoid contamination and ensure accurate results. ISO 20658 provides guidance on selecting the appropriate collection method and adhering to established protocols, ensuring consistency and reliability. Proper labeling is another crucial aspect of sample collection, as it ensures traceability and accountability. The standard emphasizes the importance of clear, legible, and accurate labeling of all sample containers, which is vital for subsequent processing. This includes information such as the patient's name, date of birth, unique identification number, sample type, and the date and time of collection, all of which are essential for proper identification. Documentation is also essential during sample collection, providing a written record of the process. This might involve completing a requisition form, detailing the tests to be performed and the sample type, recording the collection details in a laboratory information system, which helps in tracking and managing samples, or maintaining a sample collection logbook, which serves as a manual backup. Thorough documentation provides a traceable record of the collection process and helps identify any discrepancies or issues that may arise, ensuring the integrity of the sample from collection to analysis. Section 6, Clause 5, Sample Transport, maintaining integrity in transit. Once a sample is collected, it often needs to be transported to a laboratory for analysis. This step is critical in the diagnostic process. During transportation, maintaining the sample's integrity is crucial to ensure reliable test results. Any compromise can lead to inaccurate diagnoses. ISO 20658 provides detailed guidelines for safe and effective sample transport, ensuring that every step is standardized. One of the primary concerns during transport is maintaining the appropriate temperature, as it can significantly impact the sample's condition. Some samples, such as blood cultures or certain hormones, are highly sensitive to temperature fluctuations. Even minor changes can affect their stability. The standard stresses the importance of using temperature-controlled containers and transport boxes to preserve sample integrity. This ensures that samples remain viable for testing. The standard also addresses the acceptable time frames for sample transportation, which is crucial for maintaining sample quality. Delays in transport can lead to sample degradation and affect test results. Timeliness is essential in this process. ISO 20658 provides guidance on maximum transport times for different sample types and emphasizes the importance of minimizing delays whenever possible. This helps in maintaining the sample's integrity. Documentation continues to play a vital role during transport, ensuring traceability and accountability. This might involve using a sample transport log to track the movement of samples, recording the date and time of dispatch and receipt, and noting any deviations from standard transport conditions. Accurate records are essential for quality control. This documentation provides accountability and helps identify potential areas for improvement in the transport process, ensuring continuous enhancement of sample handling procedures. Section 7, Clause 6, Sample Receipt, ensuring a smooth transition. Upon arrival at the laboratory, samples must be received and processed efficiently to minimize any potential for error or degradation. This initial step is crucial for maintaining the integrity of the samples. ISO 20658 outlines clear procedures for handling samples upon receipt, ensuring that every sample is treated with the utmost care and precision. The first step involves verifying the sample information meticulously. This includes checking the patient's identification details, ensuring that the sample matches the accompanying documentation. The type of sample received and the requested test must also be verified to ensure accuracy. Any discrepancies between the accompanying documentation and the received sample should be immediately investigated and documented to prevent any potential issues later on. Once verified, samples are logged into the laboratory information system, creating a digital record. This step captures essential information such as the date and time of receipt, the sample's condition, and any other relevant details. It also records the individual who received it, ensuring accountability. This electronic record facilitates traceability and accountability throughout the sample's life cycle, making it easier to track and manage samples. Not all samples arriving at the laboratory are acceptable for testing. Some may be compromised. Samples that have been compromised during transport, such as those exposed to extreme temperatures, must be carefully evaluated. Samples with labeling errors must be rejected to maintain the integrity of the testing process. ISO 20658 provides clear guidelines for identifying and handling compromised samples, ensuring that only samples meeting the required quality standards are processed. This helps maintain the reliability of test results. After receipt and verification, samples must be stored appropriately until analysis to prevent any degradation. Different sample types have different storage requirements which must be strictly followed. Some samples might need to be refrigerated or frozen to maintain their stability, while others can be stored at room temperature without any issues. ISO 20658 emphasizes the importance of adhering to these specific storage conditions to preserve sample integrity and prevent degradation, ensuring reliable test results.